June 9th, this past summer, I was involved in a pretty serious bike accident where I tangled up with another rider, went down, and wound up fracturing 8 ribs. I've had some broken ribs in the past, and the recovery is long and painful. The rib fixation enabled me to get back to doing what I wanted to do remarkably fast, where I was able to climb the Grand Teton 88 days after surgery, and I completed a half Ironman triathlon 103 days after surgery.
Thanks to a new approach to treating chest injuries in Baystate Medical Center's trauma program, Terry and many other broken rib patients are experiencing a much faster and less painful recovery.
Literally within days of the surgery, I was back up to full lung capacity.
The therapy is a significant advance from the long-held standard of care for broken ribs. Treat the patient's pain with narcotics and wait for the fractures to heal. The new approach convenes a multidisciplinary team around the patient to look at every potential impact of the injury on adjacent organs and tissues and to minimize collateral damage and complications. Trauma surgeon Dr. Andrew Dobin, who performed Terry's surgery, developed the rib fixation program at Baystate Medical Center, along with Dr. Ronald Gross, the hospital's chief of trauma.
It's a process. It's not one person, it's not one piece, it's the entire puzzle that has to be together. And I'd like to think that we're leading the charge here. Patients that benefit from it the most are elderly people, people with multiple comorbidities, people with malignancies, because you are able to get them to recover and return to a baseline with very, very minimal deficit.
Pain management is a crucial part of the new therapy. Treatment also features a new surgery that uses a combination of metal exoskeletal plates and pins to keep the ribs entirely immobile while damaged bone and tissue heal back together, resulting in reduced pain and a shorter recovery.
We've had fantastic outcomes. Bill is one of a series of a number of patients that we've had. He's one of the most elite athletes that we've had, which has been fun for us because we knew we could improve him and we knew we could get him better quickly. What we didn't know is how quickly we could get him back into his competitive sports.
Thanks. Come ride with me someday.
I hope I can keep up with you.
Yeah, we'll try.